Hi, I'm Greg Slayton. I'm the president of Salvin Dental. And my expert tip is on allograft tissue. Allograft tissue processors are not the same. And unfortunately, when tissue processors kind of go outside the lines of the standards set by the American Association of Tissue Banks or the FDA, unfortunate things can happen. For example, in a widely known incident in 2008, a general dentist was convicted of illegally pilfering bone and soft tissue from funeral homes in the Northeast. How did that happen? And that human tissue was sold to tissue processors. In another incident more recently, the FDA did an inspection of a tissue processor in Nevada where the area around the clean rooms where tissue is processed was dusty, and they found exercise equipment and a motorcycle. And tragically, in a recent incident, a tissue processor on 2 different occasions failed to identify donated tissue that was contaminated with tuberculosis. That tissue was processed and later implanted into 2 different patients, which led to their deaths. It's tragic, which is why as clinicians and as industry leaders, we have to hold our standards extremely high and understand that donated human tissue is a gift. It is not a commodity. Someone has decided to donate their human tissue upon their passing to help improve someone's life, or in many cases, save their life. Well, here's the good news. Salvin Dental, we are extremely excited and proud of our long relationship with LifeNet Health. They are the largest tissue processor and organ procurement organization in the world. And since 1995, they have processed over 10 million biologic allografts with 0 incidents of disease transmission. And of those 10 million allografts processed, 2 million were distributed by our company. Many of those grafts were implanted by members of the Seattle Study Club. So when we're talking about allograft tissue, it's critical that you understand where the tissue comes from, how it's processed, and understand the safety protocols that the tissue process has in place. If you have any questions, give us a call. As always, we're here to make your lives easier and improve your surgical outcomes. We're always going to take great care of you. And that's my expert tip.